Hello, and welcome to the first episode of Apparently with Astra. This is episode 1. I'm your host, Astra, and I'm so happy and excited to be here. This show is going to be focused on parenting and pregnancy, and this is a podcast that I've been dreaming about since I was pregnant, really, because you may not know this, but you will quickly learn that I am probably one of the most neurotic people on the planet. And when you combine those neuroses with pregnancy, well, everything just kind of implodes. I thought everything was going to go wrong. I kept going on Google, getting questions to see if what I was doing was okay. And eventually, he popped out fine, my little baby Ethan. But I know that there are lots of moms out there with questions and they want a safe space where they can share their experiences. And this is how Apparently with Astra was born. Now, I know what you're wondering. Why this name, Apparently with Astra? What does that even mean? Well, I've got a guest here with me. Her name is Dr. Tracy Archer OB-GYN. Actually, mine. Is it former now? Can I still come?
You keep coming.
I can come. My OB-GYN, Dr. Tracy Archer, is here with us today. Yay.
Thank you.
How are you doing today?
I'm great, thanks.
Would you like to know why the name of the show is called Apparently with Astra? Okay. Dr. Archer, when does a joke become a dad joke?
I don't know.
When it's apparent. Get it?
I got it.
Because it's apparent.
I got it.
So I thought to myself, wow, really good joke with the word apparent. It's got the word parent in it. Apparently with Astra. Welcome to episode 1. All right, so let's...
I'm glad to be here.
You are...
Apparently with
Listen,
Astra.
this is my first episode. I couldn't think of anyone else for the first episode. I needed to get a guest. And thankfully, you could make it to tell us a little bit about yourself. And of course, answer some questions that a lot of new and expecting moms have. Before we get to that, let's talk a little bit about you, Dr. Archer. Now, I feel like I know you at this point. I mean, I've been seeing you for the past year and some. But for those of you who don't know Dr. Archer, why don't you tell us a little bit about yourself?
Okay, I'm a OB-GYN for the last, more than 10 years. I went to Combermere School.
Right. We'll just fast forward past that. Carry on.
And then did my medical degree at University of West Indies before I went off to UK to do my postgrad in OBS and gynae. So I was there for about 5-6 years, and then I returned in 2009. Initially working in the hospital, and then I left to my prior practice from about 2010, I think.
Wow. So did you always know that you wanted to be an OB-GYN, or was it something that when you started probably in your teenage years, you thought to myself, man, I really want to be a doctor?
I don't remember. I remember wanting to do engineering. And the next thing I knew was medical school.
Wait, pause. That is a massive difference.
Yeah.
Nobody trips and falls into medical school. Am I wrong? What?
And I never tell this story because I always hear people say things like, "Oh, I always knew I wanted to help people," and I don't remember that light bulb moment.
All of those cliche things that they say.
I just remember when I went into sixth form, I did not do biology because I was like, I'm not doing anything with biology.
You weren't even interested in biology, and that's like the easiest of all the sciences.
And I wanted to do physics and math. That's all I knew I wanted to do. So I was very set on
bit of a high
engineer.
achiever.
And somewhere inside of there, it switched off to medicine.
Somebody lured you with a thermometer.
Maybe. My mother's my mother, because she's a nurse. Mm-hmm. She was actually a midwife. So everybody asked me, is it because of your mother? I'm like, no. Oh, I don't remember. Or maybe it was just subliminal messaging she was doing.
I wonder, because now I'm imagining your mom crawling into your bedroom at night as you sleep, and she like just says over and over, you want to be a doctor. You want to be an obstetrician gynecologist. This is your path. You wake up one day and you're like, you know what? I think I want to be an OB-GYN.
And it wasn't even OB-GYN. It wasn't, no. It was when I actually graduated from medical school, my first love, I think, was pediatrics. I think.
Right.
It wasn't ONG for sure. It was either pediatrics or surgery. But anyway.
Right.
I did my internship in pediatrics in Jamaica. And I keep hearing babies cry in the middle of the night in my sleep. And I thought, I can't do this every day. So I did pediatrics in my first rotation when I was an intern. Then my second one was obs and gynae, and then I loved it. I really, really enjoyed it. So
what you're trying to say is that you're okay with the process of giving birth to the baby, but once they start crying,
that's it.
You're over it. So you move from pediatrics over to
out there.
I love it. Yeah. Well, you know what? You stay true to yourself and you're really good at what you do.
Thank you.
I mean, do you have any free time to pick up engineering on the side, or is that fully?
My sister is an engineer. Yeah, my sister is an engineer. She breaks that.
Do you have a bit of sibling rivalry? Like, I should have been an engineer.
No. And she's glad she didn't do medicine, so both of us are the same thing. Yeah.
Wonderful.
I'm sure she sleeps more at night than I do. So.
Probably.
Yeah.
You probably get all those calls in the middle of the night. Yeah. Like, I think this is happening.
Baby starting to seem to want to come down.
Well, I have to say, you look very fresh-faced today. And
I had a good night's sleep last night, yeah.
Good. I am really, really hoping that these questions aren't delving too deep and keeps you up at night tonight. So I have this entire little list here called Ask Dr. Archer. And it's going to be interspersed with my birth story, as well as questions that I have gotten from my social media. And by the way, you can follow us on social media. We are at Besocial Podcasts. And you can also follow me at radio.astra. And Dr. Archer does not have a social media because she hates the internet. With that being said.
For now.
Now, when I first found out I was pregnant, it was in early January of 2019. I had taken about 8 pregnancy tests and they were all negative. And I thought to myself, but my period isn't coming, and I feel a little bit weird. And I kept having these odd dreams, and I kept taking this pregnancy test day after day after day, and it kept coming up negative. Now, partially it might have been because I bought the cheapest pregnancy test on the market. But regardless, I feel like if you're pregnant, you're pregnant. It shouldn't matter the price of the pregnancy test, right? Definitely. So eventually I kicked up and I bought the one for $17 instead of $8. And it finally said that I was pregnant.
So the moral of the story is
just, you're either going to pay on the front end or the back end, right? So my first question is for those who think they are pregnant and they keep getting negative pregnancy tests. Would they go to a general practitioner or would they come to you, an OB-GYN, to figure out? Because if you feel like, listen, my period isn't coming anymore, it's been a couple of weeks, the test is showing up as negative. Mm-hmm. What would be the process? What's the next step?
Well, the best time to do a pregnancy test is actually your first urine of the morning because it's more concentrated then instead of a dilute urine. So that's usually why I said, just do an early pregnancy test first. Mm-hmm. If that's negative, you can probably still see your GP as well. Because we have the option of doing a blood test to confirm. You do the pregnancy hormone, we can actually measure it in the blood to actually confirm whether you are or not. But the first thing at home, instead of creating anxiety, just do an early morning urine pregnancy test.
Yes, that's probably where I was more of a mid-afternoon gal. So when I finally found out that I was pregnant, yay! I called my sister before I even told my husband, and she was like, oh my gosh, you need to go and get prenatal vitamins. And she said to me, you know, Astra, you should have been on prenatal vitamins all the time if you were trying for a baby. I mean, you don't even know what's going to happen now because you weren't on prenatal vitamins 3 months ago when you were trying for the baby.
So where was she before this with all this knowledge?
I don't know, Dr. Archer, but my question is this. Ideally, you are supposed to start your prenatal vitamins 3 months before.
Folic acid.
Folic acid.
Just the folic acid. You don't need the whole thing. So folic acid, ideally should start 3 months before and continue for the first 12 weeks of pregnancy. Yeah. So the role of the folic acid really is to prevent any neurotube defects. So basically the defects of the brain and spine. But over time we've done quite well in fortifying food with folic acid. So if you look at sometimes you look at your salt, it has in folic acid. You look at your flour, it has in folic acid.
Right.
Because it's not easy, you don't get a whole lot of it in your diet. So that's why we have, we've done that. Fortifying food with folic acid, we've done probably a few decades ago. So you have less neurotube defects, but we still say, ideally you should start, once you've known that you're starting to try in, you should start your folic acid.
But for those who...
400 micrograms.
Which is the minimum. Okay.
Some
can you do
higher? You can. And some people require higher. Usually we told who require higher. They got some people who are folate deficient.
Yes.
For some reason. If you had a baby before with a neurotube defects, if you're on certain medications that metabolizes folate, that break it down quickly, then you will need to replace that.
Oh.
And some women who are very overweight as well will require a higher dose. So most people will require the 400 micrograms.
Can you take too much folic acid?
Not more than comes in a formulation.
What about for those women who just like all of the vitamins at the back of the prenatal vitamin list, and they're like, you know what? I don't even want to get pregnant, but let me tell you, this thing has in the folic acid, the vitamin E, the A, the C, the D, and all of the other nutrients. Let me just take it as a daily supplement.
And you're not trying to get pregnant?
And you're not trying to get pregnant. You just want to take that as a supplement.
That's fine, because non-pregnancy supplements contain more or less maybe a variation in dose. You can get them in other vitamins as well.
Okay, interesting. Now, if you find out you're pregnant, I really thought that immediately I would be heading straight to the doctor, Miss Thing. I was like, okay, I am pregnant. I told my mom, I told my dad, let's go to the doctor. Let's start the checkups. I called Dr. Archer's office and I was told very succinctly that I would not be seen until my minimum eighth week of pregnancy.
Yes.
Why is that?
Well, some people need to be seen before. Most people don't. The ones we need before are people who come into pregnancy with an existing disease, high blood pressure, diabetes, epilepsy, on medication that we may need to adjust, that need to be pregnancy safe. So if we've not had the consultation with them prior to pregnancy, so ideally we would like to see these women prior to pregnancy.
Yes.
So we can modify. So once you decide you want to get pregnant and you have high blood pressure, diabetes, epilepsy,
kind of like pre-existing conditions.
Yeah. Then you should see a gynecologist before. So you can do your pre-pregnancy planning, change the medication that needs to be changed to pregnancy-safe medication. That's why we need to see that and earlier, right?
Okay.
So typically we leave visits until around 8 weeks because we can do a scan and see something then.
Little dot.
If I come out 5 weeks, it's guaranteed I wouldn't see anything, and that would just increase your anxiety. So I know for sure by 8 weeks, I can scan to ensure that there is a baby there. Baby's heart rate is fine. I may be able to tell, maybe it would tell us more than one. That's usually done a little later, but maybe you could tell if it's more than one. Make sure it's in the right place. So those are things I can see for sure if you are 8 weeks. If you come out 5 and 6, I don't see, it just increases anxiety. Then I say you got to come back, and then you go home and you get worried.
What's wrong with anxiety? There's nothing wrong with anxiety when you're pregnant. What are you trying to say, Dr. Archer?
So yeah.
So I understand the 8 week, and I do remember my 8 week scan with you and seeing the teeny tiny little dot, and I think you could see the heart beat, even though you can't see much going on or where the head or the legs and all of that. You could see the little heartbeat fluttering, and I saw that on Valentine's Day of February 14th, which was very, very sweet for me. That was actually the day that we announced more to our close family and friends, because that first 8 weeks, like you said, not being able to see anything on the scan, you don't want to get everyone excited, and then, something bad happens and you don't get to celebrate. And everybody's like, what happened? So you don't want to have that conversation. A lot of people don't want to have that conversation. But I do remember the 8-week scan, and it was the first time in a long time I had to pee in a cup for non-legal reasons. No, I'm kidding. But you do have to pee in the cup. You have to get your weight taken. You have to get your blood pressure taken. And this is something that you're going to be doing every time you go to the doctor. And first, why do we have to do the urine sample? What are we giving it over for?
So that first one, we tried to send it to a lab to look for any infections because there's something called asymptomatic bacteria. So mainly you have an infection that you don't know, which increases the risk of kidney infections. So in pregnancy, increases the risk of kidney infection, miscarriage, preterm delivery. So you want to identify that early now so you can treat and reduce the risk of those complications. After 20, we still do it all along so we can pick up other things.
Oh, I remember.
Urine infections and so.
Yes.
But from 22 weeks, we combine the urine with the blood pressure to detect preeclampsia.
What is preeclampsia?
Elevated blood pressure and significant protein in the urine. So it's just a disease that only happens in pregnancy. All right. So because of the changes that happen to the placenta, some women, not all women, there are some people who are more at risk, can have changes that happen in the blood vessels of the placenta. So and the mother as well. So your blood pressure goes up. The kidneys get leakier, so they spill more protein in the urine. It's the mother itself. For the baby, it can result in reduced blood flow to the baby, so the growth might be a little bit slower.
Oh, wow. Are there symptoms that a pregnant mom kind of has when they have preeclampsia before even going in for the official test? Is there like a headache or a...
Severe preeclampsia, not mild. Severe preeclampsia. You can get headaches, flashing lights, blurred vision, abdominal pain, generalized swelling. Every pregnant woman gets swelling their legs. And
I was just about to say, based on those symptoms, from the headaches to the swelling to fatigue and stuff like that, I mean, most pregnant women...
Headaches typically will come in the early part. You don't usually get headaches all the way through. You can. But it's just a combination of all those factors along with the hyperpression and protein. But I want to stress on the swelling. Swelling in the legs in particular is very, 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 very common in pregnancy.
Right. I thought you were going to say serious because I was like, I was swollen.
Every pregnant woman tells me, but it's very common. And the reason why it's common is because the blood flow does not come, your uterus blocks some of the blood flow back up to your heart as quickly as easy as when you're not pregnant because there's a little obstruction. So any part of your body that's hanging down, so mainly your legs, right?
Yes.
You can get the blood or the fluid leaking out of the blood vessels because it's not moving as easy into tissues, and so your legs will get swollen.
So is it like pooling? Common. Is it pooling down there?
Kind of.
Wow. Yeah. See, I'm not a doctor.
So when you hang your legs
you see when the blood pools in the legs and then it gets swollen.
It's not really blood pooling. It's just some fluid leaking out into the tissues. So if you keep your legs up, so say you're sitting for prolonged periods of time, you just get a little poof or something outward, put your legs up. At home, you sit in the same thing, in the bed at night, get some pillows.
So there's really nothing kind of like internally you can do to stop that? For example, like cutting salt out of your...
No.
Because it's all to do with the baby.
It is all to do with the baby.
Wow.
Yeah.
All right. So once you start putting your feet up and the swelling should go down, or is it...
Should go down. So most people find that when they wake up in the morning, their feet are not swollen. And then by the end of the day, this is normal pregnancy. We're not talking about preeclampsia.
Right.
This is normal pregnancy. So once you find early in the morning, before you're up and about, your legs are normal size.
Right.
On your feet. And then usually by the end of the day is when you notice that your feet are swollen. Shoes not fitting as well.
Right. So ladies, although I wore heels all throughout my...
Yes, the clicking in the office announce your arrival. Yes.
That is the sound of joy and happiness of a new mother to be. Click,
Absolutely.
click, 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 click. And, I'm going to be talking about heels and other myths and misconceptions about pregnancy very, very soon. So stay tuned for that. But listen, there are so many tests that you have to take while you're pregnant. Mm-hmm. It is mind-blowing how many tests. And the thing about Dr. Archer that I really love is that she doesn't really like let you know like too far in advance. So say it's the next, you're going to your next appointment, and they just say, okay, well, in the next appointment, you're going to have to go and get your blood taken, or you're going to have to go and get the glucose test, one of my personal favorites. But the one that I really want to talk about, do you have an idea?
Group B strep.
What's it called again?
The Group B strep one?
Yes. Because in my mind, I was like, is it Hep or Strep? I can't remember.
Group B streptococcus.
Group B strep. You didn't give me a heads up.
The thing is,
very surprising test.
Did you do the midwife visit?
I did do the midwife visit.
And you got a booklet.
I did get a booklet.
Detailed everything we were going to do for the rest of the pregnancy.
You expect me to read during my pregnancy, Dr. Archer? I have so many things to do. Google. Okay, I got to put my feet up. All right.
And
I got to take a nap. I got to Google. And now you want me to read. I do remember the little yellow booklet. I still have it at the house. So let's talk about that test specifically. Okay. Because I think most people have an idea of why you do the glucose test, to make sure that you're metabolizing sugar properly, and you're going to have to drink basically what is dehydrated Fanta, and let it sit for 30 minutes, and they're going to test your blood sugar. But my question is, why did they have to sit me up on a table, take a Q-tip, and do you know what to you know where? You can use your medical terms if you'd like. What? Just describe it for us.
Group B streptococcus is a bacteria, a bacteria that we consider to be, what's the word I'm looking for? Anyway, it can live in your vagina normally.
Okay.
Commensal, that's a word, commensal, medical word. So basically is, in your vagina, there are bacteria. There's no sterile vaginas. No. They are bacteria, and they're there for a particular reason, to maintain your normal environment.
Right.
So Group B strep is safe for you, normally. If we found it, if I was to do a swab on you now when you're not pregnant, I find it, it's just normally part of you. It wouldn't cause you an infection.
Right.
It's just a commensal bacteria that's there, that lives there and helps with your normal vaginal health. But in pregnancy, not in pregnancy, during delivery, if it's in your vagina, there is a possibility. I can't remember the exact percentage now, but there's a possibility when the baby's passing through the vaginal canal and they take a breath, they can inhale the bacteria. So it's one of the more common causes of neonatal sepsis, so infection after birth. So we try to prevent that, and which can mean baby could be admitted to NICU or require antibiotics and care. So we try to reduce our risk of transmission by testing to see who carries Group B strep bacteria. This test is done somewhere between 35 and 37 weeks pregnant.
So get ready, ladies.
And it's a swab. Typically, it's a combination. So there are two ways you can two methods. You can have a combination of lower vaginal and rectal. All right, which is a bit more sensitive, or you can do only lower vaginal.
I still can't remember which one happened to me because I blacked out.
I do both.
Okay, you did both. It's just a blur, honestly, at this point.
So if that's negative, it's fine.
But if it's positive,
we only treat during labor.
And how does one treat it?
Antibiotics in labor.
Is it just you take a...
No, is IV.
Okay.
Yeah, so usually to repeat those, usually the recommendation if you're not allergic to penicillin, the type of penicillin we give, and it's every 4 hours until delivery.
All right, so like we said, there's a lot of tests, so stay tuned for that. And for the moms who have already been through it, tell your friends. Do you know how many friends that I have had babies, and not one of them, not one, Dr. Archer, mentioned this. And somebody online actually said, if we knew how many tests that it would take to have a baby, half of us wouldn't even have them.
You still will. I'm sure you still.
Yes. I mean, Dr. Archer knew, and she had a baby who's now
16.
beautiful young lady. Shout outs to her. Do we do podcast shout outs like the radio?
Going to that school.
The school that shall not be named. Because it doesn't need to be, because everybody knows it. So, Dr. Archer, eventually you're going to get to that point because, it's time to have the baby. And sometimes the baby comes on time. Sometimes the baby comes a little bit early. And sometimes the baby just refuses to knock on heaven's door and come out into the world, which is what happened to me. I was 41 weeks pregnant. I basically looked like a beluga whale. I rolled out of bed every morning and I would look down at my belly and say, why don't you just come out already? So there's only a certain limit to the time that a baby should stay in mommy's womb, right? I mean, you can't go for as long. If, everybody says, oh, well, they're comfortable in there. Let the baby, when the baby's ready to come, the baby will come. But sometimes the baby just doesn't seem to get it together and get ready to come out. What's the limit, would you say? What's the cutoff point for most moms?
Well, truly, there's no hard and fast limit as like has to, as a mother have no choice. But what we do tell you is that anytime after 38 weeks, the placental function starts to reduce. After 42, it significantly reduces, and significant after 42.
And and what does that mean for the baby when it reduces?
So that means the baby is not getting as much nutrients as it was getting prior. So the supply to the baby actually reduces, which then can compromise the growth, development, heart function. So the recommendation usually is delivery before 42. And most people would say somewhere between 40 and 42.
Yeah, I went in at 41.
Fast. Yeah.
Yes, because you asked me, you said, well, it's 41 weeks. Do you want to take the weekend? Because it was Thursday. You're like, we could take the weekend. You could see if you could eat some spicy food, you could have some sex, eat some more spicy food, probably have the sex before the spicy food. Yeah. And maybe baby will show up. He didn't. And I wasn't ready to wait any longer. So I said, let's go in and induce the following day. Besides spicy food and sex, are there any other hard, fast, would you say, like suggestions to kind of get things going on the anecdotal side to induce pregnancy?
Yeah, but a lot of them don't have any strong evidence. The strongest one is probably, so not just sex, but it's ejaculate. Because it's a prostaglandin. So the prostaglandin what helps soften the cervix. So it's the prostaglandin itself that helps to soften the cervix. Okay,
well, don't tell the guys that. Put in the work first. I mean, come on. Am I right? Kara guy's like, what? All right. So somebody also mentioned vigorous walking might help. A nice hike. You can. Anything can.
Yeah, anything, but there's not a lot of.
Okay. So you know what? Let's talk a little bit about heading in to the hospital. You finally figured out it's happening. Baby is coming. They call you. And I say, pretend that I'm one of those moms right now. Ring, ring, ring. It's 3 a.m. So answer the phone how you would answer.
Hi, good morning.
Oh, hi, Dr. Archer.
Like
no, you wouldn't. Why would you say, what is it?
I was like, hi.
And I would say, hi, Dr. Archer. I know it's really early in the morning, but I'm pretty sure little Jacob is coming. My baby's not named Jacob, but I'm not me. So little Jacob is coming. But I'm not sure. I feel like he's coming, though. Can you tell me if...
before 3 o'clock in the morning, while you were still pregnant a few weeks ago, we would have discussed what to look for.
And what would that
Not
be?
At 3 o'clock in the morning.
Right, so I'm going to pretend like I am one of your patients calling in because I'm pretty sure that I'm having my baby, okay? Ring, ring, ring. It's 3 a.m. It's 3 a.m. Answer.
Hi, Dr. Archer.
Hi, Dr. Archer. Oh, I'm so sorry to call you so early in the morning, but I'm pretty sure that my baby is coming. I just felt something a little wet between my legs. 38% sure it's not pee. So can you help me? What do I do?
Go to the hospital.
Go to the hospital. Are you coming? Will you meet me there?
We'll meet you there. But what happens when we tell you go to the hospital?
Mm-hmm.
So, well, ideally, in the weeks leading up to whether you do talk with us or you do, people call them the mass class, but just call them birthing classes. You might do a birth class with a nurse or a physiotherapist or whatever. So you get an idea of what labor is like. I mean, nobody can prepare you. You know, people always think they know. They don't think they will never know. But when it's there, you know.
Yeah.
You know when you actually go into labor. You cannot go in. When you're in labor, those contractions come. It doesn't disguise itself as anything else. It is what it is.
You know,
so
I think
we had that discussion.
The biggest issue, honestly, I feel like with the whole concept of labor is what is seen on TV and all media platforms really about what labor looks like. Mm-hmm. And I was one of those people who fell into the trope of this is what labor is going to be like. Mine was nothing like that. And I don't think probably 90% of the women have a labor like they do on TV, where the water breaks. That's the first sign. Yeah. The water breaks. Everybody goes, and then they get rushed into a cab, go to the hospital, and then 30 minutes, she starts screaming. It's 3 pushes, and the baby is out. Yeah. Regular labor. Let's talk about a more traditional labor compared to the one that you see on TV. It starts off with probably mild to moderate contractions. And irregular.
So they vary in time. And they vary in intensity as well. Most people will start out like that. There's people who go abruptly into it, but most people start off with irregular, painful. And you see, pain is so subjective. Because you get somebody who will say, I'm having the worst pain in my life.
Me.
And
people is me.
and this cervix said that they're not in proper labor yet. Well, I would get somebody who said, they contract. And when you examine them, they're almost ready.
Wow.
So pain is very subjective. So we tend to go with things like frequency, how long they last, and that gives you a better idea of your contractions. So if it start coming closer together, we usually a cutoff of every lasting for 5 minutes. Every 5 minutes or lasting for 5 minutes.
That would be horrible. Could you imagine if a contraction lasted 5 minutes?
Yes. So it coming every 5 minutes, lasting for 60 seconds or more, and going on for like an hour. So we know for sure there's no going back now, right?
Yeah.
So that's what we define.
Shove the baby back in there. He's coming.
Come to the hospital. Because some may come in every 20 minutes, some may come every 10 minutes. You know, and you still have that phase, what we call latent phase. So we don't define labor now. So until you get to about 4 centimeters. So especially in women who have their first baby, going from 0 to 4 can take a while. Can take hours, can take days.
Wow.
It may not be that days and that they're getting intense pain all those days, but just sporadic, irregular contractions that can happen. And the best place for that to happen is at home.
Now, you see, that never happens on TV. No. Days of contractions, and for a lot of people, they get their contractions before their water breaks.
Yeah, most people.
Right. So on TV, the water breaking is usually the first sign that a baby is coming. Yeah. I mean, they could be doing anything. They could be playing volleyball. They could be at a dinner party, and
it's always somewhere embarrassing.
It's always somewhere embarrassing. You see, I felt like less of a woman because, mine started in the hospital because you induced me. That does not make a good sitcom. Number two will be better. All right, Scott, you heard the woman. Get to it. So like we were saying, so the contractions and then the water breaking, and then you kind of monitor.
And the water breaking could happen on its own.
Or
you may have to break it for you. So it depends. So like in an induction, I know you're ready with this one. I know for induction, the part of induction is breaking your water and stimulating the contraction and initiating contraction.
Okay, pause. Did you notice she said the word stimulating and massaging and all of these super positive words that makes it seem like, oh my gosh, am I having a baby or going to a spa? Well, let me tell you something. You are having a baby, and Dr. Archer is going to make sure that you know it, especially if she has to induce you. Now, I never even thought of the actual manual breaking of water. I didn't even know that was something that was possible, but it is. Can you walk us through that, Miss Massage and Stimulate? Carry on.
So it's like a vaginal examination. So once the cervix is dilated, we can get past the cervix to the membranes, that bag of water, that bag that holds out the water in the baby, right?
Right.
So
how does one get past it? With what?
Your fingers.
Right.
Yeah. So we're using your fingers to go through the cervix to feel the membranes. Once you can feel it, and we are sure the baby's head is there and down, then we can use a hook to just hook on the membrane itself.
Hook!
So you don't feel the hook, because the hook is like a very narrow, what's we can use analogy? I don't know. But you don't actually feel the hook, because the hook is way smaller than my fingers.
Okay.
Right.
Well, let me tell you, when that water broke, I felt it. I felt the water breaking and gushing, and I thought to myself, oh gosh, they're going to need to buy new sheets for the hospital. What is going on? So when that happened, does that aid in the contraction starting to speed up a little bit?
Yes. So breaking the water along with giving the drug oxytocin, combination is what starts the contraction and continues the contractions, right? So either one by itself for induction doesn't work as well. The two together, they augment each other. So for induction, you need to have your water broken.
Well, now that we've talked about all the pain that comes along with the baby, let's talk about pain control, which I was a big fan of at the hospital. Thank you so much. I decided to go with an epidural, which I guess is probably like the most extreme you can go to when it comes to pain control. Are there any other pain control options for moms?
Yes. So we have the, I don't like to use the word natural, but we have the non-medical, the non-medication options. So things that help are just having somebody there with you, having that person there with you, whoever you want, whether it's your partner, your mother, doula, somebody there that's there with you. So partners are great. But sometimes you need that person who can motivate you. Because sometimes partners feel, oh my gosh, she's in so much pain. This is not working for her. Please help her. She's going to die. I'm going to die watching her. And, you want that person with you. You want to have that birthing experience. But sometimes somebody else that's also there, who've been through it, who can talk you through and say, this is normal. Stop it. Stop screaming.
Right.
You're fine.
That was Dr. Archer for me, because I literally had a hysterical breakdown at the point of him coming out. I had a hysterical breakdown, and you kind of set me on the path, like, okay, we got to focus. This is happening. Let's do this.
Yeah.
And we did it. He's here. Yeah. But I have to ask you, what is the craziest thing that you've seen? Has anybody ever, passed out because they saw their loved one in the bed giving birth? Like in the sitcoms, somebody passes out.
Do you remember when you were admitted to the hospital? I'm not supposed to say hospital, right? When you were admitted to the hospital, did they ask you to write? Did they ask Scott to do a form? Ask Scott about that form. There's a form that some people ask you to say. Should you pass out? Just remember, we need to look after Astra and baby first and then tend to you. Basically, that's paraphrasing it.
Basically, we don't care.
No, we don't care. We'll do them first.
We care very little bit.
We'll come to you. So you sure you want to do this? If you're sure, just sign this form.
That is hilarious.
Yeah.
I mean,
one of those forms there. But yes, it's not very often because, and there are some people who know they can't handle it. So they will stay behind the curtain.
Because there's blood sometimes. Yeah. There's fluids. Yeah. There's all kinds of things that are happening.
Can't. So they tend to stay, or they back the whole process and wait until afterwards. So we've had, not that often, one or two, or one I felt. I don't know if I actually held somebody that actually landed on the ground. But you will get somebody said, I'm not feeling well.
And you just kind of stumble out the door and carry on.
And then, we just carry on.
Listen, the last thing we need is somebody on the floor taking your attention when baby is coming and mom's trying to give birth.
Yeah.
So I totally get that they would have to sign a form. I have to ask God about that form. I want to frame it for...
yeah, it's probably in your notes, not the hospital still. But in terms of the other painkillers, I want to talk about this a little bit.
Sure.
Because you cannot prepare yourself for labor unless you've been through it before. So I like people to have an open mind about, so having somebody with you is good. Walking around is thought to help as well. They have things like acupuncture, massage.
There's the little bouncy ball.
The bouncy ball that
right.
you can go on. So it's usually just an exercise ball that you get.
Yeah.
You that you can thing. And then there's something called transcutaneous electrical nerve stimulation, TENS, we shorten as TENS. Probably don't have a lot of it here, but it's just a small size of a biggest cell phone.
What does it do?
And so you attach some electrodes until during labor.
Mm-hmm.
Whenever you get the contraction, you just
press the button.
It sends an electrical impulse because it's going on the theory that it's called the gated theory of pain, which means that only one pain sensation can get through the gate at the same time. Oh. So the whole premise is that electrical nerve stimulation is going to go through that pain gate as opposed to the contraction pain. So you only feel that electrical.
That's interesting.
So it works better in the earlier part of labor before that intense pain comes.
Yeah, so, before the smackdown begins. Yeah,
so that I like at home and so you just press it when you just press it.
I always said that if I had the little button for the epidural, I would have drained your reserves at the hospital.
It has a lockout feature.
Because I would be just pressing it, getting my epidural goodness.
So because of that, we have a lockout feature on it. And then
you should call it the Astra lockout feature. Just name it after me.
And then the common things that most people will hear about is pethidine. Pethidine is a narcotic analgesia. So
it's an injectable.
Yeah. Mm-hmm. So it's give it in a muscle. Most people would get her in the bottom muscle.
Okay.
Muscle. So it's used during. It's the most common thing we use here during labor. You give it every 4 to 6 hours. Side effect is that you just get drowsy though. Get really drowsy.
That's fine. I like sleep. Can you sleep during labor? I guess not. I mean, that's
like people who have epidurals go sleep.
I did not. See, it's because I was pressing it. It wasn't coming out fast enough. But speaking of the guests in the room, I know that now we are in pre-COVID times. The pandemic has happened. And I was wondering, what is it like at the hospital now? Can you still have a loved one in the room?
Person.
One person in the room. What about...
So let me just talk about... So the caveat here is that I'm not sure what's going on, what happens at the public hospital right now. Mm-hmm. I think one guest still allowed.
Mm-hmm. So but you can speak for the hospitals that you are attending at.
Yeah, so one person can come.
One person can come in. Mm-hmm. And
whoever you choose to come.
What about the baby as well? I mean, has anything changed as it pertains to handling of the baby or...
Wash your hands when you handle your baby.
Wash the hands. And
it's still gong up and mask up in the room and so, everybody has on their...
You guys were prepared. I mean, when I think about it, doctors with the masks, the gloves, the constant hand washing.
But we don't wear them 8 hours a day, right?
No.
Yeah, that's the issue. We wear when we need it. No, 8 hours a day. So now you're forced to wear it during the day.
I never got a chance to ask you about the moment that little Ethan was coming, and you could see the little hair in the canal. Mm-hmm. And I kept pushing and pushing and pushing, and I just couldn't get Ethan out. Mm-hmm. So you said to yourself, okay, grab me that plunger over there. I'm going to stick it onto his head. I'm going to pull him out. That's the non-medical way. Could you tell me, what was it that you did? Because it was kind of a suction vacuum.
So if you can achieve spontaneous, you pushing by yourself, we have certain criteria that we decide when we can help you out vaginally. Mm-hmm. That's the point of no return. There's no cesarean section there now. So if the labor is taking too long, they push in the whole. That's what we call second stage. So second stage is from when we recognize you're fully dilated, which is 10 centimeters. That's when you start to push till the baby coming out. That's second stage, right? So if that goes too long, then that's one of the indications that we can do to help you once you agree. Mm-hmm. If the baby's heartbeat is abnormal during that time, because we may not be getting enough oxygen, we have to speed up delivery so that the baby can be fine. So there are two instruments you can use, either a vacuum. So basically you just apply a little cup onto the baby's head. It creates a little suction so that when you're pushing, we're actually helping as well. We're guiding the baby out by putting a little traction on.
Yeah, because I felt like I was still kind of like helping, you know?
Yeah.
So
and then forceps is the other one.
Which we did not use.
No.
Okay.
No, we don't use forceps.
So when little Ethan came out and his head had a little suction-shaped dome to it.
Yeah.
Which
went away.
Which
quickly.
went away. It did. He does not look like that now, which is fantastic. But I guess it was the hormones or the pheromone. I don't know what was going through me, but I had ripped a little bit that area. Is it the perineum? Mm-hmm. Which is common as well sometimes if you have a baby. You sewed me up, stitches, and I didn't feel a thing. That was
I had the epidural in.
That epidural was running through me, and Ethan was on my chest, and we did the hour chest to chest. Just the laying of him on my chest, which was very, very sweet, and he was there. One of the things that I wanted to ask you before we get to the Instagram questions is, I started having these shakes after I had the baby, and I felt like my body was just rattling like an ice tray. And I had never known about it. I'd never heard anybody talk about it. But then when I mentioned it online, every mom was commenting underneath saying, oh my gosh, that happened to me too. Some people it lasted half an hour, some people an hour, some people a few hours. What is that? What is happening to us in that?
Many endorphins. And they down from the high of having a baby. So endorphins, hormones. But some people it's also the epidural. So your inability to maintain your body temperature as well. So it could have been any of the two. Yeah.
Yes. And then he showed up at 1:28 p.m. on Friday, September 27th, 2019, weighing 7 pounds, 0 ounces. And he was my little bundle of joy. And right now he is my very loud bundle of joy. And with that being said, it's now time to head over to the IG questions. Are you ready?
On there.
Oh, wait.
Okay.
Are you ready to go?
Those are
mine.
I'm ready.
Keep calm and carry on. Isn't that what they say over at your school? I can't remember. What is the motto over there?
I'm not.
You're not even. I'm just saying, as one of the few accomplished members, could you let everyone know
there are a lot of us. We just don't brag about it, probably.
I guess that's an internal decision that they made. All right, let's talk about some questions that we got from IG and see if you can answer them. And the first question is, they wanted to know if bathing late at night can affect their unborn child.
No, I don't think so. Not that I'm aware of.
No.
There's been no.
I think you should be able to, showering is good, right?
Showering is good.
I also heard that sometimes when you get pregnant, sometimes your scent can change.
I guess
that's a bit above her pay grade.
Not necessarily a bad scent that you have to shower more often.
Another question. They wanted to know if suction after a miscarriage can prevent a future pregnancy. Should suction after a miscarriage, can that prevent you from getting pregnant again?
Suction is actually a safe method of evacuating the uterus. Well, yeah, suction is actually a good method of evacuation uterus, and it has not been found to have any long-term effect on future fertility.
Okay. Now, there is also this common misconception. I've heard it from all the mothers, the grandmothers, the aunties, that bending over can cause the umbilical cord to wrap around the baby's neck, and they can end up suffocating or asphyxiating themselves in utero. Is that true? Because this was one of the questions. They were told when they bend over, it can cause the cord to possibly wrap around the baby's neck.
No. Yeah. So we've heard that before quite a bit, but no. What we do is recommend if you have to get something that's lower than you have to lower your height, use your knees to bend because you want to avoid injury to your back. So it's not bending. Bending does not affect how the baby cord, the umbilical cord, moves.
That's good to know. I feel like, honestly, as soon as somebody finds out that you're pregnant or they see that you're pregnant, they tend to start giving you a lot of unwarranted advice, which is why I wanted you to come here so we could get some advice from somebody who actually knows and has seen hundreds of pregnancies throughout their time. All right. What about things like weightlifting? I know sometimes, or exercising. You would think exercising is good for you, right? Can you exercise during pregnancy? Is there a certain level that you should not, go to when you're pregnant? High intensity versus low intensity?
So the recommendation for exercise in pregnancy is 30 minutes of moderate intensity, 5 days a week.
5 days a week? That's more than I do now.
So 4 to 5 days, yeah. So it's actually the same recommendations when you're not pregnant. So the ones we ask you to avoid is any high impact sports,
Football, American football, wrestling.
Yeah. Horseback riding, because of repetitive jerking action. I usually tell people to avoid cycling in the roads in Barbados because there's just too many potholes. So cycling is fine. If you can do it on a smooth road or if you got a stationary bicycle, that's fine. The problem with weightlifting is that your joints become more flexible during pregnancy because of the softening of ligaments by the hormones produced. So you just need to use weights under supervision because you don't want to overextend in your joints. So
right.
Weights can continue during pregnancy, but just under supervision.
Okay, that's good to know. And I also heard that if you've been, very active pre-pregnancy with your exercising, just carry on.
Absolutely. So
don't
the
stop.
Benefits of exercise in pregnancy, it avoids excess weight gain for both you and baby. Reduces the risk of high blood pressure, reduces the risk of diabetes. People tend to have a better labor with exercising. So there are some good benefits, health benefits of exercising during pregnancy.
All right. And what do you recommend to those first few days postnatal? I mean, you just had the baby. You're probably not going to want to exercise, or should you take a walk? Should you?
Yeah, I think you should. Vaginal, cesarean actually might find that you're a little bit stiff, and to get out to bed is a little bit harder the first few days. But either way, I think you should walk. Even women who got a vaginal delivery, so you can walk, do some Kegels. You can start doing Kegel exercises.
I still am not exactly sure how to do a Kegel.
Just squeeze your vagina.
Should I do it right now? Should I try?
You don't know now, right?
I can try right now.
Yeah. It's not that hard.
Are you doing it?
All the time. Squeeze it for a few minutes. Seconds.
Okay, she's sending me home with homework tonight.
Absolutely.
I'll get in there and try. All right. I think that was a really good interview. Dr. Tracy Archer, OB-GYN, to the stars. By stars, I mean me. What did you think? You're as my first guest.
It was great.
Do you think
actually, I was like, wow, is that time already?
It's an hour. 2:59. I got 60 seconds to go.
It went well. It went quickly. It was good.
So would you...
your bathing question. Sorry, Isaac.
Would you recommend some of your, potential patients to the show if they wanted to tell their birthing and baby stories?
Sure. Absolutely.
Wonderful. Great. Would you come back for some more of those stellar IG questions?
Absolutely.
Wonderful.
Yeah.
And we are going to be...
Do a show just on questions.
We could do that. We could do a full hour. Would you like to do that?
A whole hour of questions?
I will. You see, I'm not exactly sure if it's that stellar Combremere sarcasm or if she is really being honest. You see, that's that dry wit, that deadpan humor that I just love from you.
It is a combination of the two.
Well, I got to say, I myself was very, very nervous doing the first episode, but you were the perfect first guest, and I feel like we're going to have more episodes. We're going to have more information. We're going to have more guests coming through. And we want you to stay tuned. This is Apparently with Astra. And this is the end of episode 1. So stay tuned for episode 2 coming soon. Make sure to follow us at Besocial Podcasts. We'll be streaming this show on Apple Music and on Spotify. And you can also find some visual components to it on our IG at Besocial Podcasts. If you'd like to follow me, you can check me out at radio.astra on IG. And you can see the little screaming bundle of joy, baby Ethan, that I have at home. Thank you so much for listening. We'll see you next time.